What if AI could predict every disease before it happens? What if I told you there's a machine that can look inside your body and predict every disease you'll ever have? Not a doctor, not a fortune teller, an AI. Right now, artificial intelligence can scan your medical records and tell you if, when, and how you'll get sick. Before you feel a single symptom, it has already detected cancer in people who felt perfectly fine. It has flagged heart attacks years before they happen, and some say it might soon predict the exact moment you'll die. It sounds unbelievable, but this isn't a theory. It's already happening. Researchers at the University of Oxford have created an AI model that scans medical history and predicts heart disease up to 10 years in advance. In a hospital in China, a machine learning system analyzed 1.3 million patients and diagnosed illnesses faster and more accurately than human doctors. Google's DeepMind has developed an AI that can detect eye diseases, kidney failure, and even rare disorders before they show symptoms. At first glance, this sounds like a medical revolution. But here's the problem. What happens when AI decides who gets treatment and who doesn't? Imagine sitting in a doctor's office, feeling healthy, when suddenly a screen flashes your future. High risk for cancer, 89% chance of Alzheimer's, increased probability of stroke. Now ask yourself, would you want to know? If an AI could predict your entire health future, even the things you can't change, would you want to see it? Tell me in the comments. Because the next part is where things get disturbing. In the United States, hospitals are already using AI systems to prioritize which patients receive care. Some are using AI predictions to decide who is too high risk for surgery, denying life-saving procedures. A study published in Science showed that AI algorithms used by healthcare providers favored wealthier patients over lower-income ones, not because they were sicker, but because they historically spent more on healthcare. That means AI isn't just learning about your body, it's learning who deserves treatment. And it gets worse. Insurance companies have started experimenting with AI predictions. Some experts fear that soon, a single AI-generated health risk score could decide if you're eligible for life insurance, or if you'll be rejected. So the question is no longer just, can AI predict disease? It's, who will control that knowledge? And will you have a choice? Medicine is changing. AI is taking over. It's diagnosing illnesses before symptoms appear. It's making decisions about patient care. It's even being trusted over human doctors in life or death situations. So here's my final question. Would you trust an AI with your health? Or are we heading toward a world where AI doesn't just predict disease, it decides who gets to live? If this made you think, make sure to subscribe, because the future of medicine is unfolding right now, and you need to know what's coming next.